Okay, so now we've gone through the 10 skills and how you apply them from 36 weeks of pregnancy to birth. Now, having skills like patience, kindness, attention to detail, that's all good. However, you're the one who's going to do the birth. And so, what we'd like to do now is to teach you one of our Birthing Better skills, and it's about breathing. And it's a skill that we very much enjoy teaching because it's a skill that we very much liked creating, and it was a skill that we've very much liked using. And that's about breathing. Now, breathing in birth, there are a lot of methods and there are a lot of techniques out there that range from Lamaze to Bradley to hypnobirthing. Now we want to introduce you to Birthing Better because these methods are different, and they're different in a amazingly peculiar way, which is what Birthing Better families understood. Nobody really deconstructed about breathing, our humanity. How does our humanity breathe? So why did Lamaze develop a breathing method that was based on basically fast and high, but in the mouth, out the mouth? Why did Bradley develop a breathing method that was in the nose and out the mouth, whatever that meant? Why do these methods develop, and why don't they work for the majority of us? And it's because we never really deconstructed breathing. And that's important. If we don't understand how we breathe as a human being, then we can't find the breathing patterns that will help us adapt, adjust, and be sustainable throughout the activity of birthing our baby. Now, a lot of people think of birth as being labor and a vaginal birth. However, nowadays, many women have a non-laboring cesarean. And we want you to know at Birthing Better that we decided in the early 70s that 100% of pregnant women will give birth. It's an activity that we, each of us, does with our baby without exception. And what we do with our baby is an activity. We have to spend time working through an activity of birthing our baby. And that occurs no matter where we birth, no matter who is present, no matter my personal beliefs or my personal circumstances or yours, no matter what your choices are, your lack of choices, or how your choices change, or what actually happens to or around you as birth unfolds. None of those factors in any way take away from a greater truth. And that's our commonality, is 100% of us are going to give birth, and it's an activity each of us has to do. So it's an activity that each of us has to do, then it's a good idea that we have skills that work no matter how our birth unfolds. And that's what the Birthing Better breathing skills are. It's very important that you understand that we intentionally created an understanding of birth breathing so that any of us, in any circumstance, would have a breathing method that we could adopt, that we could adjust, and that we would find sustainable. So it first starts with being really clear that there are only 4 ways that humans breathe. And we'll pause for a minute while you think about them. Because in the years and years that I've taught, since the 70s when these skills were developed, I can tell you that midwives, doulas, childbirth educators, just us, doctors, anybody, just anybody on the street, you say to them, what are the 4 ways humans breathe? And most people pause. And that pause comes from the fact that it doesn't just roll off our head. But when I say it to you, you'll say, oh, I know. But you didn't come up with it right away, which meant you can't access it. And that's what's important. So all humans breathe in the nose, out the nose, in the nose, out the mouth, in the mouth, out the nose, and in and out the mouth. And you, of course, like all of us, would say, well, I know that. You do know that now, and you can explain that. So when you breathe in your nose and out your mouth, for one example, and you should do this with all of these 4 methods, when do we use that in life? And once again, that's a pause. Most people just pause. Some people will say, well, I breathe in and out and I relax. That's terrific if you did that. And it can look like this. Very focused. So it can be, or it can sound like this. When we're exercising. Or this. When we're having sex, right? Or this. Or this. So in the nose, out the mouth has a wide variation of how we use it in life, which gives you a clue. You want to choose the ones that relax you and keep you in control. You may want to, however, if you want to cope and manage and feel in control, then choose or if you've gone through the in the nose, out the nose, it may sound like this. Or like this. And it may vary. Or like this. We can vary this. But when we start to get to or we're not coping. So this is a breathing better skill. Go through the 4 variations. Find out how you use them in life. Just try out. Pick the ones that allow you to cope, manage, deal with, handle, work through, stay on top of, and feel in control. And commit to doing this with every inhalation, every exhalation, and help your other to help you do that. Because if you move very much from into it's hard to get back in control. It's hard work to stay in control when you feel that much pain. I don't like labor. Had 2 of them. And my negative voice always went F, 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 F every time the contraction hit. But I knew that I wanted to stay in control. So I used the breathing. I used Lamaze with the first birth. Didn't work very well, but I developed these skills with hundreds of families in the 70s. And 12 years later, I gave birth again. And I focused on choosing the best coping, breathing patterns I could. And I hope you will too. See you later. Bye-bye.